Hi, my name is Ryan. I'm going to be conducting a postpartum assessment. This is my client, Barney. For purposes of this demonstration, it will be Barnett. So before entering the client's room, I want to check the doctor's orders, check there's no changes of medications, IVs, or catheters. Then when I enter the client's room, I want to wash my hands and introduce myself. Hi, my name is Ryan. I'm a student nurse. I'm going to be helping you today. Then you want to check two forms of identification. So can I check your wristband, please? And can you say your name and date of birth? Thank you. Okay, before performing the assessment, you want to check vital signs. If there was any form of anesthesia or analgesia administered, you want to do a sedation scale. Then you want to check the IV site, make sure there's no infiltration, phlebitis, any signs of fluid overload. If there's a catheter, make sure the output's appropriate, it's not kinked. Then you can go on to the assessment. So I'll start the assessment with the breasts. Is it okay if I assess your breasts? She says yes. So first you want to do a visual inspection for size, shape, symmetry, see if there's any mastitis, colostrum. Take note of the nipples, see if they're everted, if there's any redness, cracked, or bleeding. Then ask her about pain. If there's pain, do PQRST. Encourage her to wear a supportive bra during these times, just for comfort purposes. Then you want to go down to the uterus. You want to look at the fundus. Ideally, the client would avoid it before the assessment. That way you can get an accurate assessment of the fundal height. You want the fundus to decrease in height by 1 finger breadth each day post-delivery. You want to palpate the fundus to assess for firmness or bogginess. If it's boggy, you want to massage it until it is firm. And then when you're massaging it, you want to take note if there's any clots or any bleeding that are excreted during the massage. Then you want to move down to the bladder, assessing for distension, which could be a sign of retention, asking about incontinence, asking about how much they're voiding. You want it to be 30 milliliters an hour after the catheter has been removed. You also want to assess for urinary tract infection, which is a possibility because there was a Foley catheter inserted at one point. Then you want to ask about bowel. So if she's having any problems making a bowel movement, when she made a bowel movement. If she's having problems, recommend that she get up, move around. If that doesn't help, then consider asking about stool softeners or laxatives. Then you want to, if she had an episiotomy, you want to check number of stitches, if there's redness, discharge, if the wound is well approximated. And then you want to do a general inspection of the perineum, looking at the perineum for any hemorrhoids, any discharge, any bleeding. Then you want to check Homan's sign, which is a sign of DVT, which would be pain on dorsiflexion. And then you want to do an emotional assessment. So you want to check for signs of postpartum depression, if there's appropriate mother-child interaction, attachment going on. You want to ask her if she's having any problems breastfeeding, and then you would do the teaching with her about breastfeeding, about proper care, and that's it.